How is your MRCGP SCA preparation going? I'm Dr. Aurora from Aurora Medical Education, and I've been helping doctors pass exams like CSA, RCA, and now SCA for many years. And a lot of you guys have been contacting me and saying, how do I start preparation for SCA? What are the best things to use? What are the best strategies to use? So this video is going to talk about 10 key tips that I think you should be focusing on if you're about to start preparing for your MRCGP SCA exam. Let's go. Tip number one seems like a really straightforward one, but it's really important at the beginning of something like an SCA preparation timeline, is you've got to trust the doctor that you already are. Look, up to this point, you have seen thousands of patients, you have seen thousands of consultations, you've already developed your own style that is currently working up to this point. You passed many exams up to this point, you already are a unique style of consultant. Now, too many times I see when trainees start preparing for this type of exam is they kind of look around on the internet and there's lots of, well, you need to do this, this, and this, and you shouldn't do this, this, and this. And it just gets very confusing because you almost try to become a different consultant or consult in a different style that you think is right to pass an exam such as this. So tip number one is trust the fact that you've got to this point, trust the style of doctor that you already have become. And yes, maybe you'll work on certain things to get the full value out of your 12 minutes, which we'll talk about later on in the video. But tip number one is really important. Trust the doctor that you already are and don't try and become a different, perfect SCA consultant. Tip number two, really important, is don't become a robotic doctor. What do I mean by this? Having done mocks and courses and seen loads of role plays in the last probably 10 plus years, I have seen the type of trainee who becomes very robotic because they learn, for example, lists of questions that they need to do. Now, you guys might be familiar with the Aurora 3 bubbles of data gathering. If you're not, then have a look at the channel. There's lots of details on this type of thing, and we cover it in all of our courses. But in those bubbles are things like psychosocial history, of course, red flag history, finding out about ICE, for example, the patient's mind. And often what I see is that people are taking these questions and putting them into lists and therefore becoming very robotic, very scripted, very rigid, and therefore you lose the essence of the to and fro conversation that you need in data gathering. So yes, you need to keep the balance of knowing what questions to ask, and that's very important, and we do teach that, but you've also got to keep the balance of not being too robotic, remembering you're talking to another human being and not just doing tick boxing exercises. This is something really important to work on because I see that people transition from a great conversationalist in terms of consulting into a robotic, scripted doctor, and that's something that you really got to make sure you're focusing on not to become. Tip number three is always remember to fall back on relevance. This is really important when it comes to the psychosocial part of your data gathering. Too often, again, because of scripts and tick boxing, people start rolling off questions like, Mr. X, do you smoke? Mr. X, do you drink alcohol? Mrs. X, what do you do for a job? Mr. X, who's at home with you? And these are important bits of information to gather, and rightly so. You've got to understand these things. But the relevance is often lost. Or you know the relevance in your own mind, but you don't demonstrate it to an assessor or somebody listening or watching, or even the patient stroke role player. So for example, Ms. X, you mentioned that you came in with indigestion. There are a couple of things in our lifestyle that can really impact this. For example, things like smoking, things like drinking alcohol, they can lead to indigestion. Can I check if you do any of those? Mrs. X, sometimes indigestion is triggered by things like stress. Can I just find out how stressful your life is? What do you do for a job? Is it particularly stressful? You know, you mentioned that there's a lot going on at the moment. How's things at home? Who do you chat to at home? Who's around you at home? See, these kind of ways of demonstrating relevance show that you as a clinician know that, you know, as a GP to be, I know that I need to find out this information, but I'm also demonstrating to the person I'm talking to why these questions are important and that I'm choosing these questions for you and your situation rather than just asking a set of psychosocial questions. So always remember the relevance of what you're doing has to come across in the questions that you're doing to show that interpersonal side of the consultation. Tip number four might seem a really obvious one in a medical exam, but you can't forget the medicine itself. So often in these types of exams where people are focusing on consultation style and having a nice flow and rapport and being patient-centered, we do loads of good things to do that bit, but it takes us away from the core of what we do, which is the medicine. So for example, I often see people in mocks or in practicing forget their red flag questions, or they don't do a detailed enough clinical history about the headache, so they can't therefore differentiate, is it tension headache versus migraine versus cluster headache, etc. So the medicine is often lost. And similarly in the second half, if we're thinking too much about managing the patient's life or managing the patient's mind, we forget sometimes to manage the actual medicine. And of course, there's a huge amount of importance in the second half about going through guidelines and treatments and referrals and investigations, things that you do day in, day out in general practice. But sometimes in an assessment like this, we tend to forget the medicine side of it because we're focusing on all the other consultation skills parts as well. So when you're practicing, when you're revising, when you're doing mocks with us, for example, make sure you're getting those clinical bits done properly, because often the safety aspect of a consultation is coming from that particular point. Don't forget the clinical. Tip number 5, and this is something that you probably all do very well when you're generally consulting, but we tend to forget when we're in that exam scenario, is the importance of reflection and acknowledgement. Now, we talk a lot about the Aurora 3 R's of interpersonal, and reflection we talk a lot about in the ice bubble, but this is really important to actually think about throughout your 12-minute consultation. So anything the patient says that's important, anything that you notice that's important, make sure you're acknowledging and verbalizing it back. Remember, you've got a balance between doing what you would do in a consultation and getting the job done, but also remembering that you've got an assessor watching on the other side or in a different angle, and therefore they can't assume that you've picked up certain things. You have to get used to verbalizing by acknowledging it out loud and reflecting things out loud. Oh, you mentioned work, that's really important. We'll come back to that. Oh, I can see that you seem a little bit uncomfortable. Let me try and make things a little bit easier. Gosh, I can see that you're holding your shoulder. We'll talk a bit about that in a second. Oh, you mentioned that things have been difficult at work. We'll talk about that a little bit later. That regular acknowledgement and reflection shows that you're internalizing everything, not just what you're hearing, and also putting it into your mind to help formulate, how do I manage this situation? If you don't verbalize, if you don't reflect, if you don't acknowledge, these things can often get missed. Tip number 6, a very important one, organize your management plan very early. Now, a lot of you guys who've been using our courses, resources, etc., will know already about the Aurora Golden First Minute of Management and how to get those first 60 or 90 seconds really tight, working really hard for you, showing the organization so you can open up and expand in the latter part of your management plan. If you haven't seen videos on that, check out on YouTube. There's loads of videos on how to do that on the Aurora channel, but also we cover it in all of our videos, audios, etc. But make sure you get used to having a power first 60 seconds where you demonstrate. We talk a lot about the 3 Aurora steps and issues on the table. Again, if you haven't heard of these concepts, make sure you utilize some of the videos on the channel to understand them, because they can make or break how much you achieve in a management plan. So that organization, that hard work early on in management can pay rich rewards later on. If you lose that opportunity to organize your management plan early on and get ahead of the game, then you may well struggle to catch up before the end of your 12 minutes. Tip number 7, a very important one. They're all very important, but this one is particularly important. It's about not aiming to finish your case by 12 minutes. Obviously, if you manage to do that and you pick up all the issues and you bring them all back and you manage everything and you just about finish in time, perfect, really good. But don't have that as your target endpoint. Don't think, if I don't complete this to the T, where I've got up and I've said thank you very much and everything is closed down, that I'm going to struggle to score well. By the end of your 12 minutes, in my mind, I'm thinking of a different target. I'm thinking, have I A, understood that situation properly, understood all the issues, done a proper data gathering, and B, brought all of those at least back in the second half and demonstrated that they are all part of my management plan, and probably actually manage 1 or maximum 2 of those issues, whether they're clinical, non-clinical, etc. My aim is not to understand all the issues and then manage all the issues before the bell goes. Okay, that's really important. Your target endpoint should be not to finish the case. It should be to have demonstrated a core understanding of the whole case and probably manage 2 or 3 really important aspects of it. You cannot manage 4 or 5 issues in 4 or 5 minutes, and if you try and do that, you talk at 100 miles an hour and you probably still don't finish in time. Tip number 8, Really important one, don't forget the role player. The role player knows pretty much everything about the scenario that you are doing. Don't lose the opportunity to allow them to help you in subtle ways. This comes from early on in data gathering, where they're giving you potential cues. Don't lose them, don't fail to pick them up, don't fail to reflect them. This can happen in management, where you might say, look, there's a couple of things there. Is there any of those in particular that you wanted to focus on first? Of course, within clinical reason, but don't kind of pretend that the role play is there, but really I'm just talking to an assessor and you're just kind of the median that I'm going through. No, remember, they know a lot about this situation. They know a lot about the key talking points. They know a lot about the key issues in the scenario. They know a lot about what we should be achieving by the end of that scenario. So the more you can engage them, the more you can utilize their ability to maybe give you cues or to answer certain questions that push you in certain directions, the better you're going to manage and control that consultation. Now, of course, it depends on the nature of the scenario. There could be a scenario where it's very doctor-led, i.e. there's urgent stuff that you need to do, there's admissions that you need to do. That's very different. I'm talking about the majority of scenarios where there's nothing really urgent going on. You can utilize the knowledge of that role player to your advantage, or at least take up any help that possibly could be there from free information that may be coming out that can help you a little bit later on. So don't forget, the role player can be there to help you. Don't just use them as a tool to bypass and reach an assessor somewhere else. Point number 9, this is a very important one if you're practicing in study groups, and I know a lot of you guys are currently in study groups for SCA. You're doing lots of kind of evening time, weekend time, role play practice, digitally, virtually, etc. This is for you guys. You need to challenge each other. Whenever I've seen study groups happening or practice groups happening, what I tend to see is that it's all very nicey. Questions are kind of answered for free. There's no real data gathering going on because the data is given all the time. The management is just kind of all clinical and everything is like, oh, well done, that was really good and that was perfect and that was great, and everyone's really thinking about when is it my turn and when can I get onto my own cases. This is very normal. It's just part and parcel of practice. But what I would suggest is that when you're practicing with each other, whether it's in groups of 2s or 3s or 4s, I try and keep it small if possible. Make sure you challenge each other, okay? Don't just do a standard clinical scenario where you just do a data gathering history-wise and then manage it clinically. Put in a bit of emotion, ask a few challenging questions, make sure you play a little bit of a type of patient that could easily be acted out if you think about a role player in a particular type of assessment. In the second half, ask challenging questions. Don't just let the other person go through their management plan without any difficulty at all and reel off all the guidelines, investigations, etc. Put a few normal real-life queries in there, a few live reactions in there that make a big difference in terms of how you manage that 12 minutes. So A, when you're doing a role play with somebody in a group, be a little bit imaginative about what you can do from a role player point of view, and then B, when you're giving your feedback and discussing at the end, make sure you bring back some pertinent points that you felt as a role player as opposed to how you just felt as a doctor or a fellow GP trainee from a clinical point of view, and you'll find the quality of your practice goes up. We've got a whole blog on the website about how to maximize your study group practice, but becoming challenging or going a little bit up in terms of the challenge level can really improve the quality of your study group practice. And finally, before we come on to point number 10, a quick reminder about the coupon Aurora Video 10 if you want to get 10% off any of our SCA resources or packages, whether it's SCA Ultimate, SCA Gold, SCA Silver, SCA mock exams, SCA video courses, audiobooks, flashcards. We have a whole bunch of things out there on the website to try and help you guys prepare for SCA Best, but don't forget that 10% coupon Aurora Video 10. And talking of number 10, let's talk about that final but very important tip. You have to know that you are going to pass this exam. It sounds very simple, it sounds really kind of la-di-da-di, but you need to get into that mindset that I am good enough to pass this exam. I have trained so hard up to this point in my career. I am on the tipping point of becoming a GP and getting my CCT. You have to keep telling yourself that you are good enough to pass this exam. You've seen thousands of patients, like I said right at the beginning. You have to go in with that mindset that I know what I'm doing. I don't need to be perfect. I don't need to ask every single question. I don't need to say everything in management. I just need to be good enough to pass this exam to become a GP in the future. And you are more than good enough having got to this point. at this moment. So whether you're at the beginning of your preparation, whether your exam is tomorrow and you're watching this video, you've got to go in with the mindset that I know I can pass this exam. That's why we talk all about this hashtag can pass, will pass, to make sure that you get into the feeling that I'm good enough to pass. And it's amazing how much that energy, that positive vibe can filter into your performance on the day when you're very stressed and very nervous. So you start your preparation by thinking, I know I'm going to pass, and you go into the exam by saying that you know you're going to pass, and it makes a huge difference to your performance. So I hope there's been some value. 10 high power tips to get the most out of your preparation for MRCGP SCA. Like I said, we have lots and lots of resources to help you get through this period, and hopefully we can see you at some point on one of our live mock exams where we really put you under the pressure in terms of this type of assessment. Hope this helps. Any further queries, you know I am, give me a shout. You know the hashtag can pass, will pass, hashtag I went with Aurora. Have a super day.